My name is Altovise Ewing. I was born and raised in a small rural area called Pulaski, Tennessee. It's about an hour and 15 minutes south of Nashville, Tennessee, and it's a small hometown that sits on the Alabama-Tennessee line. I was born and raised in the household with my two parents and my two youngest sisters. However, I do have an older sister as well. Growing up as a child, my parents were extremely supportive and always motivated my sisters and I to pursue education to the highest degree and to pursue anything that we got involved in with passion and with enthusiasm. My parents also sacrificed a lot, so I am a first-generation college graduate. And despite the fact that my parents were unable to graduate from college, I can recall since the age of 3 years old, they always instilled in me the importance of going to college and that it really wasn't a choice for me. So they really made innumerable sacrifices so that my sisters and I could all graduate with collegiate degrees. I currently work at 23andMe, and I am a medical science liaison. I am trained specifically as a genetic counselor, and I am able to use a number of my genetic counseling skill sets in my role as a medical science liaison at 23andMe. And you can think of a medical science liaison as the person who connects various physicians, nurses, with scientists at my company. So at times we are developing tools and resources that will benefit our customers, but we really want to make sure that we're able to interact with the people in the medical field who may oftentimes have to interpret those tools and resources for patients or customers who may walk through the door. In my role as the medical science liaison, I'm able to work with a variety of people in the STEM profession. I work with doctors, I work with nurses, I work with scientists, whether they are geneticists. I also work with people who are known as statisticians, so the individuals who are very skilled in math as well as statistics. And I also have an opportunity to work very closely with the engineers who help to develop our product as well. So in my current role as a medical science liaison, the typical education that individuals obtain to excel in a role like this is a doctorate degree of some sort. So I do have a PhD, a doctorate of philosophy, so that is something that makes me eligible to serve as a medical science liaison. However, there are others in the field who may have other types of doctorates, such as a PharmD, an MD. There are also nurses who have obtained their degree as a nurse practitioner who may also be able to serve as medical science liaisons. In my role as a clinician scientist and specifically a genetic counselor, you'll find that most people will go on to obtain a master's degree in genetic counseling. That is what we call the terminal degree, or the highest degree that you can obtain in that particular field. And that does allow individuals to go on to practice as genetic counselors in various settings. So some genetic counselors may serve in a laboratory, such as myself, where I'm a medical science liaison. Others may interact with patients on a daily basis to talk to patients about various genetic testing results, maybe in a prenatal setting where there's a couple coming in to get information about a future pregnancy. There are counselors who work with individuals who may have a family history of cancer or heart disease, where they're helping those family members interpret that genetic testing result so that they have a better idea of their risk of possibly developing a condition. And then sometimes those genetic testing results can be used to help guide medication or more helpful, precise medications that should be prescribed to a person based on their genetic makeup. I am really lucky in that I am surrounded by so many wonderful people in my field who constantly inspire me and just motivate me to continue to develop professionally and personally. I like to keep up with my wonderful colleagues and peers through social media. So I'm always staying up to date on latest tweets, latest posts on LinkedIn, um, accolades on Instagram, as well as various articles that my colleagues have published. And some of the ways that I like to make sure that my skills are always current and up to date, I do like to attend conferences, so various medical and professional conferences where they're talking about the latest and greatest findings in the field of genetics. So that helps me to stay up to date. Again, in my role as the medical science liaison, I get to interact with so many wonderful people, whether they're scientists or clinicians. So having those engaging conversations with individuals where I'm able to ask those interesting questions that I may have or that my other colleagues may have. Like, I'm really lucky in that I'm talking to the experts one-on-one, and I'm just learning so much and able to stay up to date and maintaining my skills there. What I really love about my current role as a medical science liaison at 23andMe, that allows me to combine my genetics skill sets as well as my scientific background is that I get to talk to people to help them better understand what makes them unique. So I'm helping people to understand their genetic material, their genome. And some individuals are able to take this information to make decisions that will impact their health moving forward or may even impact the lives of their family members. Also, just to be able to make the connection between our ancestors, our heritage, and our health, I find that to be phenomenal as well. Like, our genetic material holds so much valuable information as it pertains to our risk for various conditions and just helping us to better understand our history and have a greater appreciation for our ancestors and where we've come from as humans. I would like to encourage all STEM students to be encouraged. Know that no one path is better than another. Do not compare yourself to others. Just understand that your journey may be completely different from your peers or even from some of your mentors or role models. But stay the course, stay committed. Try to put yourself in environments where you feel supported, where you feel encouraged. At times, pursuing a STEM field can be isolating, especially if you do come from an underrepresented minority group. So sometimes we have to actively seek out those support systems, but just know that they are there. They may not always be readily available to us, but there are people who are willing to help support and encourage and really nurture you as a STEM profession. So don't give up, stay the course. I would encourage you to do your research online, try to identify others who have charted a path that you would like to mimic or emulate, and be bold and reach out to those individuals. They could serve as role models for you, because if there's any type of information or any words of wisdom that I can impart on the next generation to make your journey easier, less frustrating. I'd love to be able to do so. And I know that there are so many others out there who would like to be able to do the same. So you are our future. We need you. We believe in you. And stay encouraged and motivated and know that you're doing a great thing. And we're all really proud of you.